Good day everyone, I am 𝐬𝐨𝐜𝐚𝐥 from BSN111B, and today I'll be showing you my return demonstration in performing the thorax and lung assessment. So this assessment is essential for the physical examination since many abnormalities can be detected by merely inspecting the thorax as the patient is breathing. So before conducting the assessment, I am going to review the client's medical record, which is done for us to know the previous medical history of the client to provide a focus for the physical assessment of the client. Now I'm going to determine the scope of the assessment, which would include the posterior and anterior thorax and lungs using the IPPA or the inspection, palpation, percussion, and auscultation. Now, I will prepare the equipment that I'm going to use to conserve time and energy, and of course, it will ensure organization and increase efficiency in performing the assessment. Therefore, I'm going to use a washable marker, a stethoscope, a centimeter ruler, paper and pen for the documentation, gloves to protect our hands from cross-contamination, and lastly, we have alcohol for hand hygiene and disinfection. Okay, and now I'm going to perform proper hand hygiene to prevent the spread of microorganisms. Okay, now that I'm all set, I can now proceed to the assessment. So for the introductory phase, we need to introduce ourselves, verify the client's identity using two identifiers, explain the procedure, and how they can participate during the assessment. So this is done to reduce the client's anxiety and enhance cooperation. Also, we need to provide our client with privacy by closing any doors and any windows and ensuring comfort by providing adequate lighting. So this is done to protect our client's integrity and enhance comfort. So now, I'm going to start assessing my client. Good day, sir. May I come in?
Yes, you may come in.
Good day, sir. I'm 𝐬𝐨𝐜𝐚𝐥, your student nurse for today. Can I see your wristband, please? Can you state your name,
I am Patrick Anay.
your birthday?
It's on April 26, 2002.
Okay, and how would you like me to call you?
Just call me Mr. Patrick.
Okay, Mr. Patrick, today I'm going to be assessing your thorax and lungs. And during the conduct of the assessment, I might ask you to stand, sit, say something, or remove your clothes, okay? And also, I'm going to touch some parts of your body. Would that be alright?
Yes, of course.
Okay, and do you have any questions or clarifications before we start?
No, none so far.
Okay, but if there's any, just don't hesitate to ask, okay?
Yes, okay.
Okay. So, Mr. Patrick, is it okay if I'll close the curtains for me to provide you with some privacy and away from disturbances?
Yeah, sure.
Okay. Okay. How about the room temperature? Are you comfortable with it?
Yes, I'm comfortable with it.
Okay. How about your position right now? Are you comfortable with it?
Yes, I'm comfortable.
Okay. So all of the information that I'll be gathering today will remain confidential and will only be used for medical purposes only. Would that be alright?
Yes, of course.
Okay, so let's get started. So Mr. Patrick, is it okay if you remove your clothes for me to assess your body's posterior and anterior parts thoroughly? Is that okay?
Yeah, sure.
Okay, thank you. For surveying the chest and respiration, we need to check for any signs of respiratory distress like nasal flaring, pursed lip breathing, and retraction or problems with oxygenation. We also need to observe the color of the face, lips, chest, and fingernails. And after that, we need to palpate the suprasternal notch and we will note the position of the trachea. Okay, Mr. Patrick, can I see your fingernails, please? Okay, the other hand. Okay. Okay, can you inhale and exhale for me, please? Okay, one more time. Okay, now I'm going to palpate for your trachea. So is it okay if I'll touch the lower part of your neck?
Yeah, sure.
Okay. 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 Now we will examine the posterior thorax and lungs. First, we need to inspect the configuration of the chest wall. This refers to the overall structure of the chest, its shape, and anterior-posterior diameter, as well as its transverse diameter. We also need to inspect the spinal alignment for deformities to determine any abnormal curvatures of the spine. Okay, Mr. Patrick, can you stand, please?
Yeah, sure.
Okay, and I need you to face backwards for me to assess your back. Okay, and I need you to put your hands at your side. Okay, and then stand straight. Okay. 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 Now I need you to bend forward, please. Okay. So what I'm looking for here is any curvatures of your spine which you don't have. Okay. Okay, you may now stand straight and you can now sit down. Okay. Okay, now Mr. Patrick, I'm going to be palpating your posterior thorax. So I need you to face backward again, but in sitting position, okay?
Yeah, sure.
Okay. Okay, now I'm going to be palpating for your temperature. Is it okay if I'll touch your back?
No problem.
Okay. Okay. Okay, for a while. Okay, now I'm going to be palpating for any tenderness, masses, or any abnormal movements in your back. Okay, just tell me yes if it has pain or discomfort, okay?
Yes, okay.
Okay. Okay. Now I'm going to be palpating for your respiratory excursion. So I need you to inhale and exhale for me. Okay?
Okay.
Okay. Okay. Inhale. Exhale. Inhale. Exhale. One more time. Inhale. And exhale. Okay. Now I'm going to be palpating for your vocal fremitus to assess the increase and decrease of your lung density. Okay? I need you to count 1, 2, 3 whenever you feel my hand touching your back. Okay?
Okay.
Okay.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay. Okay, Mr. Patrick, we are now done with the palpation. I am now going to proceed to the percussion of your posterior thorax. Okay, so I need you to cross your arms forward across your chest. Okay, just like that. And I need you to bend your head forward a little bit. Okay, so this is to separate your scapula and expose more of your tissue for percussion. Okay, so now I'm going to start percussing your posterior thorax. Okay, now I'm going to measure your diaphragmatic excursion. So, Mr. Patrick, is it okay if I'll use my marker to mark at your back?
Yes, no problem.
Okay. Okay, so now I need you to take a deep breath and then exhale and then hold it. Okay, take a deep breath, exhale, and then hold it. Okay. Okay. Now I need you to take a couple of normal breath and then take a deep breath and then hold it. Okay? Inhale, exhale, inhale, exhale, and then take a deep breath and hold it. Okay. Now I'm going to proceed to the other side. So I need you to take a deep breath, exhale, and then hold it. Okay? Take a deep breath, exhale, and then hold it. Okay. 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 Now I need you to take a couple of normal breaths and then inhale and then hold it. Okay? Inhale, exhale, inhale, exhale, and then take a deep breath and then hold it. Okay. Okay. Okay, now I'm going to measure it. Okay. Okay. Okay, Mr. Patrick, we are now done with the percussion and I'm now going to proceed to the auscultation of your posterior thorax. Okay, so this is done to assess the airflow from your air passageways. Okay, so this time, Mr. Patrick, I need you to inhale and exhale using your mouth. Okay?
Okay.
Okay, for a while. Okay. Okay, Mr. Patrick, I need you to say the word 99. Okay, 99.
Okay.
Okay.
99, 99, 99, 99, 99, 99.
Okay. Now I need you to say the word E, E, okay?
Okay. E, 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 E.
Okay. Now I need you to whisper 1, 2, 3, 1, 2, 3, okay?
Okay.
Okay, that's good. Now we are going to assess the anterior thorax. First, we need to inspect the breathing pattern of our client and inspect the costal angle and the angle at which the ribs enter the spine. So this is done to evaluate the expansion of the thoracic cage. Okay, Mr. Patrick, can you inhale and exhale for me?
Yeah, sure.
Okay, one more time. Okay, that's great. Now I'm going to palpate the anterior thorax for any tenderness, sensation, surface masses, crepitus, fremitus, or any abnormalities. Okay, Mr. Patrick, I need you to tell me if you feel any pain or discomfort, okay?
Okay.
Okay. Okay, that's good. Now, I'm going to palpate for the respiratory excursion. Okay, Mr. Patrick, I need you to inhale and exhale. Okay?
Okay.
Okay. Inhale. Exhale. Inhale. Exhale. Inhale. And exhale. Okay, that's good. Now I'm going to percuss the anterior thorax. So this is done to assess the lung resonance. Okay? So Mr. Patrick, I'm going to percuss your anterior thorax. Okay? Okay, that's good. Now I'm going to auscultate for the breath sound. So this is done to assess the airflow from the air passageways. Okay, so I'm going to use my stethoscope. Okay. Okay, Mr. Patrick, I need you to inhale and exhale using your mouth. Okay?
Okay.
Okay. Okay, that's great. So, Mr. Patrick, we are now done with the assessment. You can now change your clothes, okay?
Okay, thank you.
Now, I'm going to summarize all of the information obtained in the working phase and discuss the findings with the client. Also, I'm going to discuss with the client possible plans to resolve healthcare concerns if present. Okay, Mr. Patrick, I'm now going to summarize all of the information that I have gathered. First, regarding the surveying of the chest and respiration, there are no signs of respiratory distress and there are no problems regarding with your oxygenation, which is good. In examining your posterior thorax, your scapulae are symmetric and non-protruding, which is good. Also, your shoulder and scapula are in horizontal position, which is normal. Your spine is vertically aligned. Also, your spinal column is straight. Your right and left shoulders and hip are at the same height, which is good also. Okay? So, in palpating for your posterior thorax, your skin is uniformly warm and intact. There is no tenderness or masses seen in your back, which is good. Moreover, your respiratory excursion or lung expansion is full and symmetric. Your vocal firmitude is bilaterally symmetrical and it is felt mostly clearly at the apex of the lungs, which is good. Okay? So in the percussion of your posterior thorax, percussion notes resonate except for your scapula, which is normal. For your diaphragmatic excursion, the distance between both sides is 3 centimeters, which is normal too.
Okay.
For your breath sounds, I can hear bronchovesicular breath sounds within your scapula and sternum, which is normal. On the other side, I heard bronchial sounds on your trachea, which is normal too. However, I heard a mild wheezing in your right lung fields. Okay? Moreover, when you say phrases like 99, E, I heard a muffled sound and a muffled E, which is normal. And for the whispered pectoroloquy, which is the one when you say or you whispered 1, 2, 3, okay, almost the numbers are indistinguishable, which is normal. Okay?
Okay.
So in assessing for your anterior thorax, your respiratory rate is 16 cycles per minute, which is within the normal range. In inspecting your costal angle, it is 90 degrees and the ribs insert into the spine at approximately 45 degrees, which is normal too. Okay, so in palpating for your anterior thorax, there are no tenderness or pain, masses, or any abnormalities present. Okay, so in palpating for your respiratory excursion or lung expansion, it is still full and symmetric. Okay? So in percussing your anterior thorax for resonance, percussion notes resonate down to the 6th rib at the level of the diaphragm but are flat over areas of heavy muscles and bone, dull on areas over the heart and the liver, and tympanic over the underlying stomach, which is normal too. Okay? And lastly, for the breath sound, there is a mild wheezing on your right lung field, but overall, there are no other respiratory problems in your thorax and lungs. Okay? Okay, so do you have any questions or clarifications about all of the information?
No, everything is clear.
Okay, that's good. So, Mr. Patrick, I'm now going to give your results to the attending physician. So, I'll be back after that. Okay?
Yes, okay.
Okay. Okay, I'm back, Mr. Patrick. So, here's your prescription. Okay, and I advise you to take a rest, maintain eating healthy foods, and exercise regularly. Okay? Avoid stressful things. Okay? And
Okay.
also, don't forget to take your medicines. Okay?
Copy.
Okay. So thank you for your cooperation, Mr. Patrick. And if you have any concerns or clarifications, just don't hesitate to ask for help. Okay?
Yes, of course.
Okay. Thank you for your cooperation, Mr. Patrick, and have a nice day ahead.
Thank you so much for your service.
Okay. Now that I'm done with the assessment, I am going to take off my gloves and perform hand hygiene. Okay. Now that I'm done disinfecting, I'm going to record all of the information in the client's record. Okay, so that's it for my return demonstration. Again, I am 𝐬𝐨𝐜𝐿𝐢𝐚 from BSN 111B. Thank you for watching.